get a move on and also understand then how the healthcare system is coping with the numerous cases of the coronavirus, how they are managing the same. Let's bring on board then Dr. Ashutosh Raghuvanshi. He's the Managing Director and CEO of Fortis Healthcare, now joining in from New Delhi. Thank you so much for taking time out and speaking with us. I just want to understand what the situation is like at a time like this, because I understand that there have been, a number of cases that have taken place, and Fortis has been on top of the situation. You have managed the pandemic and the social distancing and adhering to all of these guidelines very well. So tell us a little bit better as to what the situation has been in terms of treatment, the overall supply of drugs, and just essentially managing in very scary times like this.
Yes. So as you said that this numbers have been increasing, and we as any other healthcare institution have to face that. However, since January, it was very clear that at least an epidemic is coming, if not a pandemic. So it did give us some time to prepare our
Okay, we'll just be reconnecting. Wanted to get in a perspective from Dr. Raghuvanshi as well. And he was talking about how, yes, there was some amount of preparedness. And yes, there have been, the country as well has been lauded for their steps to contain it. Dr. Raghuvanshi, apologies. There seemed to have been a bit of a blip in the line. Go ahead.
So as I was saying that there was some time available for preparation, but I can tell you that this kind of situation you can't really prepare for. So far, India has been lucky that the incidence has been relatively lower, and the mortality rates also have been significantly lower compared to other countries which really face the brunt. However, we cannot underestimate the power of caution as well as following the precautions. We should sort of lower our guard at this stage, thinking that we have already overcome this situation. So this situation is going to last, as the vaccine and the other treatments are still under development. Many therapies which were being evaluated have not really given that kind of results. So there is no other alternative except to be very careful in preventing the spread. And that's been the focus for us within the organizations as well. However, we expect that the incidence may keep on increasing sporadically and in some clusters more than the others. And we will have to keep on creating that capacity to be able to handle as and when there is a surge. Luckily, so far, we haven't seen a major surge. But as and when we see it, we should be prepared. And we shouldn't be complacent about the preventive and precautionary measures which have to be established both within the healthcare facilities as well as outside in the community, offices, or whichever businesses are functional.
Okay, Dr. Raghuvanshi, do you think that we as a country right now have the medical infrastructure to deal with the increase in cases? You were just alluding to the fact that there could be certain clusters where we could see a higher spread kick in. In that case, were that to happen, how well equipped are we as a country when it comes to our medical infrastructure and the kind of capacity that we have at present?
So, see, it is a known fact that we have inadequate infrastructure as far as both capacity as well as human resources is concerned. That's a discussion which has been going on even before this epidemic came into being. So it is important for us, that is why, to flatten the curve and make sure that the system doesn't get overwhelmed. Both the private sector as well as the public sector will have to keep on stepping up in order to create that infrastructure. and then there would have to be some intermediary options, like for example, here in Gurgaon, the Medanta Hospital and Fortis Hospital together with Artemis is creating a facility with the VPS group, which will be exclusively a COVID hospital. So many such joint efforts will have to be made. This kind of overwhelming situation cannot be handled either only by public authorities or the private healthcare sector. So there will have to be collaboration at multiple levels. And I'm very happy to see that in most states, such examples can be seen. And I think we will be able to create adequate infrastructure for the kind of projections which are being made in various mathematical models and the epidemiological models.
Okay. And what about the supply of products and essential drugs, etc.? Are they available at a time like this? Because we have seen this lockdown for the last 1 month or so. So what has been the situation? What about the future supply?
So there have been challenges initially because, the demand suddenly went up and the supply chain took some time, and there were a lot of disruptions in terms of movement of goods across the state borders, etc., which I see will remain for some time more. But I think a lot of those things have been streamlined over the last 1 month. So we are seeing more and more supplies of PPEs coming now. And a lot of other companies have stepped up to support their supply of PPEs to the public hospitals. Similarly, the private hospitals are also able to get PPEs at a much more reasonable rate. Initially, there was a price surge, but that has more or less been taken care of. Similarly, as far as pharmaceuticals are concerned, I think all our pharmaceutical companies have stepped up their work, and because of that, the supply chains have again been activated almost to the full. So we are not seeing any kinds of shortages at the moment. The second thing which is happening as a result of this epidemic is that a majority of patients who normally would come for elective procedures in various hospitals and things like road accident, etc., obviously are eliminated. And as a result of that, the load on the hospitals is only about 30-35%. The occupancy in private hospitals at the moment is approximately about 30%. And that makes the balance a little better. And for that reason, there is no immediate shortage. There are kind of, the blips which happen at a time when the expansion has to be done. Like, for example, in testing, when you need more number of kits than what you have currently, the system has to sort of evolve. That takes some time. So there have been gaps sometimes for 1 week, 2 weeks, etc. But those are gradually being overcome. The last one in this series is the testing part, which I think still needs to step up a little more. But what we are hearing from various sources in administration is that their capacity is being enhanced. And by end of May, we should have a sufficiently large capacity to do the testing.
Appreciate you taking the time out and speaking with us, and thank you so much to you and your teams for all the work you do, in order to try and save lives and being really at the front lines of this pandemic. That's the word coming in from Dr. Raghuvanshi, talking about the overall capacity, how India is prepared to deal with the crisis from a health point of view.